But that's really too narrow a way of thinking about it. And so I've realized, and I think the field's kind of realized that there are a lot more options to cell therapies. Yeah, that's a great question. If we're trying to treat something like dementia, we have to get more creative. Yes, I often get asked this question. Paul Knoepfler, a professor at UC Davis School of Medicine and a stem cell and cancer researcher. So I used to think it meant you're getting, especially when it comes to stem cell therapies, you're getting stem cells, and those living cells will actually go into your body and make a home there. That's what we call engrafting, and then become the tissue cell type that we need. So like if you put stem cells in the brain, a cell therapy of that kind, the cells will become brain cells. Some cell therapies are not actually engrafting. They just do something transiently. And so there's a lot of interest, for instance, in mesenchymal cells, which are not exactly really stem cells. They're kind of a mix of stem cells and stromal cells and other cells. There's a lot of interest in MSCs being injected, hanging around maybe for like 1 day, but having an immune modulatory function. Basically, what that means is changing your immune system in a beneficial kind of way. Now, of course, in that context, what we wonder about, and a lot of clinics offer this kind of approach, is how can cells hanging around for, say, 1 day or even less than that help someone in the long run? You know, like, can that really lead to like a 10-year benefit or something like that? It's kind of hard to imagine. So the other thing is that it doesn't have to just be the cells themselves, whether it's transient or long-term or whatever, is that the cells make stuff that is then considered a cell therapy as well. And so the one that's hottest right now is exosomes. So these are like little cellular bubbles that cells give off. And so it's now generally thought that if you give someone a potential exosome therapy, that's widely considered a cell therapy, even though it doesn't have living cells in it. Now, no exosome therapies have been proven to be safe and effective. The FDA here in the US views them as a drug that requires careful clinical trials. So another thing is that could be a cell therapy is that you actually make something from cells and you give like an extract of those cells to a patient. So here again, you don't have actual living cells. You don't have the little bubbles, the exosomes. You have something from the cells that is useful. It could be a growth factor or something like that. Finally, there's another really interesting way of thinking about it, and that is a cell therapy where maybe you don't give anything at all exactly, but you're changing something about the cells inside of a patient. So you're kind of changing their own cells. And this is where you get into sort of a gray area where it's sort of a combination sometimes of a cell and gene therapy. This has been shown to be beneficial like for sickle cell disease. So you're giving the patient cells, but those cells have also been changed. And so I think that kind of combination approach is really powerful and exciting.